Doctors of Reddit, what is your I don't know how you're alive, but we better treat you right now cases? These are medical stories, so they do get a bit gross at times. Enjoy. When I was in med school we were shown a patient who had both lungs fully collapsed, yet he came into the hospital all by himself and was only complaining about it being slightly difficult to breathe. Not a doctor, but can contribute somewhat. I had an emergency appointment with my GP after I'd been suffering from lightheadedness and exhaustion for about 2 weeks. He took my blood pressure which came to 65/40 and he was shocked I hadn't yet been admitted to hospital as my BP was dangerously low. After going to hospital it turns out I have Addison's disease and I'm one of around 8,500 in my country with it. In med school got to scrubbing on a case that bypassed the emergency room and went straight to the OR. Older woman had pointed a shotgun right in the middle of her chest and aimed it down and to the left. The entry hole was a perfect, neat, little coin-sized opening. On the other side of her was absolute shredded carnage where most of her left ribcage was shattered, left lung gone, and you could still see her heart somehow still beating. She was overall stable under anesthesia and oxygen, but holy crap. The surgeons worked for hours and got her put back together as best as they could with whatever she had remaining. And one of them said she's going to hurt like a sore toe in too tight shoes, and she's still going to wish she was dead. I'm a medical resident. On my ICU rotation last year, we were looking after a patient who had undergone seemingly uneventful open heart surgery. Over the next several days, he developed an infection, which is not uncommon. People get pneumonia after anesthesia, the skin around the surgical site can become infected, etc. Weirdly though, he seemed to be getting worse despite aggressive antibiotic treatment. Somewhere around the 5th day, it is time to take the drainage tube out of his chest. They are placed there after every surgery like this, so that blood does not accumulate around the heart, and lo and behold, literal feces start pouring out of this poor man's chest cavity. Turns out the cardiothoracic surgeon had punctured the man's intestine with a tube on the way up to his heart, essentially creating a highway for his colonic microorganisms. Ended up with multiple bacteria and fungi running rampant in his chest, abdomen, and bloodstream. Obviously needed repeat surgery to get everything cleaned out. Somehow survived, in the short term at least, despite being pretty sick to begin with. I'll never forget looking at that CT scan though. Horrifying stuff. I had a cousin that survived 2 weeks with a ruptured appendix, and the doctors at the time said if they hadn't seen it beforehand they would have said your chances of surviving that were pretty much zero. He was in hospital quite some time after the surgery, but he ended up being just fine. As a med student, I saw an asymptomatic diabetic patient with a blood glucose level so high our portable glucometers couldn't quantify it. When I did a blood draw, students do procedures here, I noticed that the plasma looked pretty syrupy. Hyperglycemic hyperosmolar state is a very dangerous condition that usually leads to mental obtundation and neurologic deficits, yet this guy was sitting and chatting with everyone who came to monitor him without so much as a headache. Not a doctor, but I fell off of a trailer and landed on my head, and they rushed me to the hospital. The doctors did some x-rays and a CT scan and sent me home. 12 days later I go to the orthopedic and I tell him my symptoms, does a quick exam and takes x-rays of my neck. Come to find out that I fractured and dislocated 2 vertebrae in my neck, C6 and C7, and tore all the ligaments in my neck. Right before I left to go to the ER he said, "Welcome to your second life, you should be paralyzed from the neck down at best." Had a little pain in my knee. Thought it was a pulled muscle, kinda felt like it needed to pop. Tried to get it to pop by kicking my foot out twice. Didn't pop, so I figured I'd go sit down and massage it. Took a step and got dizzy with a little tunnel vision and hearing impairment. Went to the hospital and walked in. Mentioned I thought it was a blood clot. Previous job as EMT, so they took me back. I laughed and joked the whole way. Poked fun at a nurse for bluing a vein in my left arm. Did a chest CT, and they found a fairly large saddle pulmonary embolism. Doctor mentioned that I shouldn't have been awake with the percentage of blockage I had, let alone walking in and being my jovial self. Got me meds and gave me a nice suite for a weekend. I'm now on blood thinners for life, and damn are they expensive. Not a doctor, but a patient. I was in a bad car accident in high school, where I went off a 38-foot drop. I was conscious, and got out of the wreck. The ambulance picked me up, and noticed my blood pressure wasn't reading correctly, and had trouble finding a pulse, but they didn't seem too worried as I was talking and awake. We get to the ER and again they are struggling to find a stable pulse. They continue to try to figure it out, while they start stitching up the wound on my head, and I just passed out. Turns out, I was probably bleeding in the car a lot longer than I realized, and had lost over 30% of my blood volume. The paramedics didn't realize how much I had bled, because the car landed in a way that almost none of it ended up on me. The car was on standing completely vertical on its front, and I didn't seem confused, or show other signs of hypovolemic shock. The hospital gave me a plasma transfusion and fortunately everything turned out okay, but the doctor told me it was a lot closer to turning out bad than I realized. Later that week, we went to get my stuff out of the car and the entire hood and most of the dashboard were just covered in blood. My mom just broke down in tears and couldn't go near the car. It was crazy. Late to the party, but why not? I'm a doctor. A couple of months ago a young guy comes in for a CT of his chest, abdomen, and pelvis. His history is difficulty swallowing and not very hungry. I read the studies and I have never seen so much cancer in any one patient in my entire career. Over half the volume of his chest was filled with metastatic disease. His liver was entirely replaced with cancer. His spleen was a single large met, and one of his kidneys was completely destroyed. He has diffuse carcinomatosis throughout his abdomen with massive ascites, and every lymph node was abnormal and enlarged. A CT of his neck showed huge lymph nodes and an MR of his brain revealed at least 8 separate metastases. Apparently, when he was 16, about 9 years prior, his mom took him to the doctor where they removed a skin lesion that turned out to be melanoma. He was referred for follow-up, but mom decided they were too busy. Skip ahead to today, the guy is still around, and his tumors are shrinking a bit. He's doing okay, mostly comfortable, and hanging in there. Mom is a basket case. 35 plus years ago, my dad, age 53, a farmer, never any health insurance, developed pain in his gut. Always had a touchy stomach, nerves, stress, food. It was bad enough this time, or different enough, that he finally went to the doctor, little country clinic says, and sends him to the nearby hospital to get a scan/x-ray. It was a day or two after that long to read scans back then, they called him and said, "Get to the hospital now, your appendix has burst." Just he and I at home. I was 13, so he drove himself to the hospital. He recovered but it was a tough surgery, and it was probably hours from being too late. The surgeon said the appendix had partially burst then had tried to heal itself. Fast forward 30 years. My sister, age 53, develops stomach pains. She suffers with it for a night, and finally tells my mom maybe she should go to the hospital. Her appendix had burst. It was hours from being too late. I've got less than 3 years before my appendix expires, it seems. My mum has back surgery and a few days later became extremely ill. She called over 12-year-old me and confided I may die. Jesus. So they get her into a room and they have no idea what her symptoms are caused by. They decide it may be a plague, so we have to gown up, gloves, mask, the whole thing just to see her. It was awful. And they couldn't fix it. They didn't know why. And then a student doc looked over her chart for funces and said, she just had back surgery. This aligns with a spinal fluid leak. So they get her in and realize it's so significant that they could have lost her in 48 hours. She good now. I was on rounds in the outpatient clinic with our internal medicine doctor. A patient walks in and complains of blurred vision. Routinely one of us, the students, would get up and check the blood pressure manually for practice. It was my turn. Mind you, this is the first time I practice on real person that's not one of my friends. I confidently wrap her arm and place my stethoscope and start pumping. I hear the first throb on the reading too fast. I pause and start again. The first throb comes too fast and I check the reading again. I slowly lock eyes with our doctor. She finishes explaining something to our round group and makes eye contact with me. So, what's her BP? I pull down my stethoscope and slowly pass it to her. Not sure, but I think you should check it out yourself. Her face went pale. It was 240/120. That's it for today. Thanks for watching. Do all the YouTube stuff and check out this playlist if you're not done procrastinating.